I'm Adrienne Pan, and this is CBC Edmonton News. Canada is in the midst of an unqualified public health emergency with the current opioid crisis. That's the finding of 3 medical and addictions experts who are calling on our governments to take greater action before more lives are lost. The current number of dead is around 20,000. Members of the healthcare and justice systems from across Canada are meeting in Edmonton right now for a conference on fentanyl. Here are some thoughts shared by Edmonton Police today.
This is not an issue that can be dealt with strictly through law enforcement. We're not going to wrest our way out of this problem. We need a multifaceted approach and resources from a number of areas to control fentanyl abuse. The fentanyl trade is fueled by addictions and greed. Those addicted need help. They need more addiction clinics, drug counselors, peer support groups. They need access to the antidote naloxone.
With me now is one of the experts I mentioned a few minutes ago. Dr. Hakique Virani is a public health and addiction medicine specialist physician and clinical assistant professor in the University of Alberta's Faculty of Medicine. Thank you so much for joining us.
Thanks for having me.
Now, you believe the opioid crisis is a public health emergency and should be declared as such. Why is that?
So it is an emergency in that the amount of death and illness that we're seeing from this chemical hazard or opioids is in excess of what we would ever expect. Opioids are exacting an unprecedented toll on our population. The question is, what do we do about that? And the reason why myself and my colleagues believe that this should be declared a public health emergency is because the ordinary measures that have been used for the past couple of years to mitigate the risks to human health have just not worked. And declaring a public health emergency under Alberta's Public Health Act gives the Chief Medical Officer of Health certain powers that allows the allocation of resources specifically to deal with this emergency. It does not mean that we have to use all of those powers, but what it does mean is those things that have been impediments to this point to mitigating the damage that's being done by opioids can then be, those barriers and impediments can be overcome with special powers.
Okay. What do you think of the government response so far to the opioid danger, especially here in Alberta?
Well, there's a few things that have gone well. Well, there's one thing really that's gone well. It's the expansion of naloxone distribution programs. And that's very much a credit to our needle exchange programs and a credit to, I think, some work that's being done by the Medical Officer of Health in Calgary. This was a decision that was taken by the previous government to expand naloxone programs. And our new government, I think, has advanced that cause nicely. But in terms of access to treatment for the addiction that is driving this public health problem, in terms of access to harm reduction resources and services that would mitigate the damages from this problem, we've not come as far as we need to. In fact, we've not come anywhere at all. So in terms of the government or the public health response, I think it's unfortunately inadequate.
Okay. You support safe injection sites and many don't. Why do you think this is an essential tool in the fentanyl fight, for example?
So I think this is an essential tool in public health, period. But particularly when we're dealing with a unique and unprecedented hazard in fentanyl and even more dangerous fentanyl analogs that are in our population, safe injection sites or safe drug consumption services are known to save lives. We also know that you cannot transmit infectious or communicable diseases in a safe injection site like you can if you're using needles on the street.
Yeah.
And those are, there's no debating that. There's excellent evidence to show that this has been the experience of Insight, for example, in Vancouver.
And yet many people are still vehemently against it.
There's definitely a moral rub, but I think that when we're dealing with a crisis like this, or when we're dealing with public health, the questions are not ideological questions. They're not about what some people think are right and what some people think are wrong. This is about what is true and untrue. And in science, the definition of true and untrue is what you can prove. And what's been proven is that safe injection services work. And we need far more of them throughout the country, but certainly in Alberta, we need at least one, which we don't have yet.
Yeah, and how well equipped do you believe doctors are to deal with opioid addiction?
So I think this is one of the areas that we touched on in the article that we wrote for CBC, and that is that physicians, because this is a common problem, need to be trained to deal with addiction that presents to their practices. And particularly those physicians who see people who are high risk for morbidity and mortality or sickness and death related to opiate use. So in emergency departments, physicians should be trained to start treatment for addiction. In places where physicians are likely to see somebody who injects drugs, they should be trained to treat addiction. Doctors who see pregnant patients should be trained to treat addiction, or at least should know where they can send their patients, and we should have places for those patients to go to mitigate the risks of drug use.
Yeah.
There's no question in my mind that this is a critical issue, the availability of physicians to provide that care, but this isn't something that is an insurmountable barrier. One of the reasons why we've said that perhaps emergency provisions should be used to provide that care.
Yeah. Earlier, we heard EPS talk about the fact that you can't arrest this problem away. How would you rate our justice system response to fentanyl so far?
Well, the first thing I would say is that the police response and the police understanding of this fentanyl problem or the opiate problem in general has been excellent. In Calgary and in Edmonton both, that credo that we cannot arrest our way out of this problem and we need to cooperate with public health has been so heartening. Unfortunately, most of our drug policy is focused on enforcement throughout the country. I would say that about 80% of our resources are focused on enforcement, but the war on drugs has been an abject failure. They're entirely correct. We cannot arrest our way or incarcerate our way out of this problem. In terms of our justice system's response, I think that from law enforcement up, there's a recognition that this is a public health problem. I am concerned, though, when elected ministers, including of justice, would weigh in on whether or not this should be declared a public health emergency. The entire reason for public health acts across our country is to remove from politicians the singular responsibility of protecting health, which must sit in public health and should be independent of politics. So when you hear ministers talking about whether or not Public Health Act provisions should be exercised, it makes me very, very concerned.
Okay, some really, really great points here. Thank you so much for fleshing out this issue for us.
That's my pleasure.
Dr. Hakique Virani is a public health and addiction medicine specialist physician, and as he mentioned, he helped write an opinion piece you can find on our website calling for more action on Canada's opioid crisis.